Good morning, everyone. Today we're going to discuss about the topic and have a detailed presentation on the Myth Busting Friday about hypnosis and how the free will is there, or is it something that we need to discuss. So the objective for today is to also discuss the myth that hypnosis can control someone's actions against their will, and to provide a clear understanding of the process, techniques, and the efficacy of the hypnotherapy. Move the slides. Now, what is hypnosis here? It means that somewhere, if we could read the presentation, that it's a trace-like state of heightened focus and concentration, often achieved with the help of a therapist using a verbal repetition and mental imaginary, right? And also, it involves a voluntary state where there is an active participation, which requires the subject's active and individuals who cannot hypnotize against their will, and also the awareness and control with which the hypnotherapy has been taking place, because people remain aware of their surroundings and can reject any suggestions they find uncomfortable. So, the reality of the hypnosis includes the voluntary state, which includes the active participation and awareness and control, and as well as the ethical practice, which is the therapeutic use of it. Now, hypnotherapy can be used for therapeutic processes such as managing pain, reducing stress, and overcoming habits, but it has to follow some strict ethical guidelines to ensure the safety and the well being of the clients. So, the hypnosis process, in overview, we could say that it's an activity that needs to be consent from both the therapist and both the client if it is suitable for his or her own condition, or if that client is ready for that activation part or not. Right now, the process of hypnotherapy needs to be discussed in detail, where it talks about the initial consultation, where we are taking an assessment, where understanding the client's issues, goals, and medical histories, as discussed in my previous slide as well, that this hypnotherapy process cannot be just taken just like without any understanding about the person's disorder or any problem issues. So, building a trust where there is a comfort and trusting relationship between the therapist and the client is extremely important. Then there's an induction phase where we are using methods such as deep breathing and progressive muscle relaxations to induce a trace-like state in order to relax the client, or maybe when we were having the starting the process of the hypnosis, we need to make the client easy in a way by having some relaxation techniques and having a focused attention where the guiding the client to focus on specific thoughts or images, right? And that thoughts and that images or that thoughts could be anything which is related to the person's mind or the way you want to progress as a therapist. Now, deepening the trace, which means that um, it has to have a visualization techniques, the counting down technique, and repetitive phrasing. Now, why these three are important? Because it encourages the client to visualize the calming and peaceful scenes, and counting the backwards to deepen the relaxation, and you're using the repetitive phrases to reinforce the relaxation and focus, right? Initially in your master's or maybe in your bachelor's, or must have done a thorough research, or maybe have seen a videos over hypnosis or hypnotherapy. We could see how therapist keeps on repeating some phrases and relaxation to focus on the client's mental well-being and seeing what is going on their mind, right? And at the same time, we have some paper beside us to note down what the client is going through and how the progress rate is needs to be traced down by the client. So we have some specific sheets as well where we are having a progress or a sheet to note down the hypnotherapy processes. Then, gradually, when there is a therapeutic environment which has been established by these three stages, which is the positive affirmation, maybe inducing the positive suggestions aligned with the client's goals, or maybe some guided imagery, because we are helping the client to visualize achieving their goals or overcoming obstacles. Then there is a post hypnotic suggestions that happens, because the suggestions or actions or thoughts that will occur after the session is to reinforce the therapy as well. It is because the client came in the therapy sessions, it's just an hypnosis and a part of the therapy. So we need to have some post hypnotic suggestions where we are creating a suggestion impact and an overview of what and how the session went well, and we need to update the client as well, and we have to discuss those results with the client and how it can be impactful and will align with the goals of the therapy. And gradually, when the client is back to this normal state, or maybe there's a gradual return, there has to be a normal state of awareness. Then there is a reintegration part that happens because it ensures the client fully awake and oriented before ending the session. So that's how the stages or the process of hypnotherapy works in, and it will help us to give a process and a structure how the hypnotherapies goes in, right? But there is some discussion in the future slides that we need to do, that if that many therapists are not in the favor of this hypnotherapy and many therapists are. So here we are today discuss about the hypnotherapy aspects and if it's relevant and which should be used in our practice or not. Then, what are the techniques used in hypnotherapy before we dig into the topic? Which is the first is the cognitive behavioral techniques, which is the fundamental tool that is used in hypnotherapy is reframing, which is the changing the negative thoughts into the positive ones, and then there's a behavioral modifications where we encourage the changes in the behavior through positive reinforcement. So in CBT, everything has to be conducted, but the two things that are extremely related to hypnotherapy and the aspects of CBT, which is it is reframing and behavioral modification. Then there is Ericssonian hypnosis, which talks about the indirect suggestions using metaphors and stories to introduce suggestion very slowly and very subtly. Then there is a tailored approach, which talks about customizing techniques to the fit of individuals' clients' needs and responses. Right? Then, apart from the two, the third one, which is very important and which is most talked about these days into our research field, which is the neuro linguistic programming, which talks about the language patterns, which is using certain and specific language patterns to influence thoughts and behavior, right? And then there is anchoring, which associates certain stimuli with desired responses. So these three aspects and the techniques has to go in hand with techniques used in hypnotherapy, apart from the research studies, because this topic we feel that has been well established, but there's some new researches that needs to be integrated by having a hypnotherapy sessions to make it more better version of it, right? So CBT, Ericssonian hypnosis, and the neuro linguistic programming, along with research study, would give you an extremely good structure to start with the hypnosis as well. Then the efficacy of hypnotherapy. Now, ethically, we have to share and see that what are the scientific evidences that proves the efficacy, as mentioned in the previous slide as well, the research part of it. So the clinical study suggests that it can be effective for various conditions such as chronic pain, anxiety, and smoking sessions. So there we can integrate these therapy. Sometimes it can be backfiring some certain disorder and conditions. So we have to be extremely critical and see that where and when we have to integrate this therapy, this hypnotherapy. Then there's a meta-analysis which needs to be done, whereas the reviews of multiple studies which indicate some positive outcomes for hypnotherapy in improving psychological and physical health of the person, right? Then there is a patient testimonials where the success stories have to be there, because having a scientific evidence is great, but in the practicality needs to be integrated as well, where we're seeing that many patients report significant improvements or maybe showing some not so good effect on their conditions and overall well-being. So there has to see that what are the long-term aspects and benefits of it as well, where their continued benefits are often reported after this therapy usually. But again, the biggest mistakes as a therapist that we should not do is the fact that we should not treat every person the same, or maybe not generalize so much that we can overlooking that person's uniqueness or maybe person's individual condition, right? So just have a thorough assessment parts to it, that if this person, and discuss with your client if this person is ready for the hypnotherapy or agrees to the idea of that. And even if the therapist and if the client is not sure about it, just start with few 15 minutes or 10 minutes hypnotherapy sessions to see what if it works around for the client or not. Then there's a limitations and concentration that needs to be taken care of, which is that not a cure, it is not a overall cure that needs to be given by hypnotherapy, because it is not a magic solution. It may work for everyone, but not for someone. And then there's a very complementary approach. what we mean by complementary approach is that it is used as a part of the comprehensive treatment plan with other therapies. So we cannot solely rely on this, and we need to consider about the limitation considerations of this therapy as well. Then, moving ahead, the conclusion part of it, which is that it acts as a very myth, um, in terms of if hypnosis cannot be make you do things against your will, or it is a collaborative or voluntary process. So we have to really question on the idea that sometimes a client may feel that we are going against, or maybe it is your instincts or your clinical understanding that might work for him, or maybe it could be a part of a voluntary process that a client is willing to contribute to, right? And it also has a valuable tool in it where it can ethically and appropriately can be a powerful tool for a positive change, where the most important aspect is the informed perspective. We need to give them an informed perspective of what is to going to happen in their sessions, and if they believe in this therapy or not. Because one of the most common pervasive misconception about hypnosis is that it grants the hypnotist to complete control over the hypnotized individual, compelling them to perform actions against their will, or maybe to the scenes often depicted in any way they feel. So this myth perpetuates the idea that a hypnotized, what do you say, maybe a hypnotized a person is in a state of complete submission and can be manipulated into engaging in behaviors that they could otherwise find morally or ethically unacceptable. So from a psychologist perspective, I feel that's what we are here for. The reality of hypnosis is starkly different, and hypnosis is fundamentally a state of a focused attention and heightened suggestibility, but it is not the mind control. That's what I researched, and when I was preparing this presentation, that it process requires the active participation and consent of the individual being hypnotized. And contradicting to a popular belief, individual in hypnotic state retain full control over their actions and are capable of rejecting any suggestions that conflict their personal values or moral compass. So during the hypnotherapy, the therapist employs techniques such as, I think so, the guided imagery and deep breathing and progressive relaxation to help the client more effective way and trace back the state. And this state is characterized by, again, concentration and allowing the individual to focus intensely on specific thoughts and images, right? But again, the ethical consideration and therapeutic application makes a lot of difference. So have an ample amount of internships, or maybe have an ample amount of work, or maybe have a thorough research in it, or maybe see how the therapist or maybe experienced person is bound to do that, because they adhere to strict guidelines to ensure that all the suggestions are made during the hypnosis align with the client's therapeutic goals and personal values. Because, for instance, a therapist might use hypnosis to help a client manage chronic pain, maybe reduce anxiety, but in such case, the suggestions provided are designed to empower the client and positive behavioral changes that has to be aligned with the client. So, in conclusion, I would say that the misconception that hypnosis can make people act against their will is not supported by psychological research or clinical practice, to be very precisely. But hypnosis, as understood by psychologists in other way, is a collaborative and very voluntary process, right? That enhances an individual's ability to focus and respond to suggestions, but it does not override their free will or ethical judgment. So, understanding this reality will help us to dispel the myths and highlights the legitimate and valuable application of hypnotherapy in improving mental and physical health. Because there is already a stigma around mental health that we are just here to talk about things, and here there is no evidence. We are doing some past life regressions, but again, we have to back ourselves with strong researches and evidence and strong, strict guidelines for the client and tell them and make them it. So again, the importance of hypnotherapy again relies on the fact that if the therapist and the client is convinced by the idea. Then today, I don't want to have a question answers with you, but relatively a more discussion oriented question. That according to you, as therapist so far that you have been practicing in your field, what do you think that what is the one common misconception about hypnosis, and how does the reality of hypnosis differ from misconception according to from your perspective? This is what today I went on my perspective and understanding about this topic. But anybody would like to contribute today, and so far what they have understood and what is their idea about as a psychologist, and we all as a community can discuss on the fact that if hypnosis could be used in our therapy intervention and what is their ideas holding. So anybody out there? Yes, Kanisha, please go ahead.
So, a big myth for me that kind of got debunked today was the fact how you mentioned that if something is not a part of their belief or value system, they do kind of have control over it. So I did think that it was always just like a stage show, like a magic show, and kind of the person has no control over themselves at all. But now I know that that's not completely true. They do have some locus of control. So thanks for that. It was a very, very interesting presentation today.
Thank you so much, Kanisha, to adding more depth to the conversation and the presentation, that how it is so important to have a consent, in not in terms of consent formally, but to see if the belief system of the client aligns with the fact that if there is okay with the hypnotherapy or not, and if they believe in that kind of therapeutic modality or not. So yes, thank you, Kanisha, for adding that. Anybody else would like to discuss on or maybe add more to this, to the idea of hypnotherapy? Okay. Thank you, everyone, for giving me your time for the today's presentation. That's all from my end. If you have any questions to me, then do let me know. Thank you for the presentation.
Thank you, Priyanshi, for a precise and well-expressed presentation on the topic, and for making Myth Busting Friday a success. Uh, all right, if anyone have any question, you may ask now, or we will move towards the feedback. Ashani, any feedback from you?